Hi, everybody. Happy Monday evening. I am Dr. Jordan Leasure. I'm the owner and physician of North Shore Proactive Health, a state-of-the-art wellness clinic in the northern Chicago suburbs. And we are in our stress relief boot camp. We are talking gut health tonight. So I had a great question this afternoon on one of the posts. Where should I start with gut health? What should be my priority? And we're going to really run through a lot of this really quickly right now. So if you have paper nearby and a pen, I would suggest you get it so you can make notes. You can write down things that are relevant to you. Say hello as you're tuning in. Give me a thumbs up if you can hear me, if we're good, if gut health is a good topic for you. If you're watching the replay, let me know. So feel free to put replay or put later, or let me know what time you're watching. It would be awesome. Hi, Rachel. Thanks for tuning in. And unlike a lot of the videos, I do have some notes up right now. I'm going to also pull up this conversation because we are doing this on my phone. Facebook does not allow me to do Facebook Lives from my computer. I don't know, I'm banned. So I'll do my best to go back and forth. If you have questions, I will get to them during the live. And if not, I will answer them as soon as we get done. So feel free to put notes in the questions as well if there's something I can get to. So let's jump right in. Food hypersensitivity. What is that? If you are eating something and it is not agreeing with you, even if it is allegedly supposed to be a healthy food, let's take eggs, for example. Eggs are one of the 8 most inflammatory foods. So you want to watch and figure out, why is that happening to you? Is it an issue with the food itself, or is it an issue with you? I will tell you, if you have or have thought of having food sensitivity testing done and you come back as being positive to a great variety of foods, the problem is not the foods, the problem is you. You have leaky gut. I would diagnose that if you were my patient immediately, and we would work on healing the gut. What does that look like? We're going to do a whole video on healing the gut because it depends on the problem. Tonight's video is outlining what the different options as far as problems could be, so you know what to be looking for. So consumption of certain foods can trigger an autoimmune response. That's what food hypersensitivity is. And associated issues that I've seen in the office include GI symptoms, of course, like IBS, constipation, acid reflux. We're going to talk about that tonight for a second. Bloating, itchiness, rashes, including eczema, psoriasis, different muscle aches, including restless leg syndrome, joint aches, headaches, fatigue, memory impairment. Remember, anything that's going on in the gut is also going on in the brain. So if you, a child, a spouse has been diagnosed with leaky gut, you've got leaky brain as well. Things are not working up here as well as they should be. If you've suffered from a concussion, it works, vice versa. If you have a brain injury, if you've suffered from a concussion, if your children play sports, they have leaky gut as well. You want that addressed immediately. There is way more to concussion treatment than simply not using electronics for a couple hours. Postnasal drip, ADHD, severe depression, autism, irritability, sinus congestion, infertility, ovarian cysts, sinusitis, all of that can be traced back to food hypersensitivity issues. Hypersensitivity can result from, of course, increased intestinal permeability from antibiotics. So again, antibiotics have their place, but in my opinion, they are heavily overused in our society and they have some very severe consequences. So you want to be very careful if you have to have an antibiotic, what you're doing to heal your gut after that time. There are some very, very specific probiotics that you should be taking in order to heal up the damage that was done from antibiotics. It can also occur, some of this food hypersensitivity can occur after aspirin or NSAID use. So if you're experiencing chronic pain and you are routinely utilizing any sort of NSAID or aspirin, you want to take a look at your gut permeability as well. Consumption, of course, of inflammatory foods are going to be a problem. The top 8 most inflammatory foods, again, are going to be gluten, dairy, sugar, eggs, soy, artificial sweeteners, and corn. Top 7. I'm missing one. It'll come to me. So yes, all of those are inflammatory. I had a great conversation with a patient this morning that is Hashimoto's, and she's reading a book that recommended that she go dairy-free and gluten-free, and in her mind, that didn't leave her anything to eat. She is a big fan of yogurt, apparently. And yes, unfortunately, dairy does include yogurt. Dairy does not include eggs. So you want to make smart choices if you are still continuing to eat eggs. You want to eat clean eggs. The unfortunate thing with a food hypersensitivity is that the reaction can occur 2 to 36 hours after food consumption. And it varies greatly person to person, even for the same food. It can vary greatly within an individual, and it is nothing like an allergy. So if you have a food allergy, you eat shrimp, for instance. You have an allergy to shrimp. You eat a shrimp, your throat closes up. Obviously, you have an allergy to shrimp. A food hypersensitivity is very different. It can look like anything on that list I just gave you. You could eat, let's say, eggs, and they make you irritable. That looks very different in all of us. You could eat dairy, and it could cause breakouts. It could cause skin. It could cause pimples. You could eat gluten, and of course, like we've talked before, if you have a thyroid issue, it can cause an autoimmune reaction, which in turn is Hashimoto's thyroiditis. So you want to be really careful with food sensitivities because they are not obvious. They are hidden for most of us. So that's why the only way to truly know if you have food hypersensitivities is either running an antibody test or doing an elimination diet. So I always tell my patients there's an easy way, which is the testing, but you got to pay for it. And there's a more challenging way, which is an elimination diet. So it depends. What is your priority? If you have plenty of time and not extra money, then maybe you want to do an elimination diet. If you want to know right away and you don't mind spending like $175, which in my mind, the testing is the way to go, then you get an answer right away. So there's some options when it comes to food hypersensitivities. It can also be based on how often you're eating the product, the quality of the product. So I did a video before, not all eggs are created equal. So you want to pay attention to the quality of eggs. And of course, sugar, the types of sugar, where you're getting your sugar. Alcohol does count as sugar. So you want to be careful with that, especially these days. And just pay attention to yourself and your children. Behavioral disorders are one of the main things that I see. Again, assessing IgG antibodies through blood is the easiest way to get an answer. There are also some tests that test IgE. Doing the elimination diet is an option. It can be kind of challenging for some people. It takes a little bit of time, and you have to make sure you're eating very clean, very specific things that are not cross-contaminated, which again can be rough because eggs are in a lot of stuff. Gluten, of course, is in a lot of stuff. So you're not going to be eating a lot of processed food. You're going to be eating very simply during that elimination diet. About 90% of people have a significant sensitivity to one food. And 80% of our patients are sensitive to milk products and eggs. Again, unfortunately, most people are eating low quality eggs, and that is the issue. Anybody that's on like a keto diet and is eating dozens of eggs upon dozens of eggs, you're probably going to end up with a food sensitivity. So you want to be really careful. That's why I recommend that if you're doing keto, it should really be monitored by a physician. 60% of people have a food sensitivity to gluten, which would include wheat, rye, and barley. A lot of people have issues with pineapple, which is kind of random. Pineapple is also used quite a bit in anti-inflammatory products. It's known as bromelain. It works very well, but unfortunately, if you have a sensitivity, you don't want to be using that. And about a third of the individuals that we've tested have an issue with almonds. So you want to be looking at those sensitivities. Again, if you are sensitive, if a test comes back and you're sensitive to like everything across the board, you're really not. You have leaky gut, and that's what needs to be looked at. Severe gluten sensitivity has been associated with substantial reduction in blood flow to several areas of the brain. And I don't think any of us could handle that right now. So we want to make sure our blood is getting to our brain is working as well as it can. So minimizing or eliminating gluten is something that I recommend to a lot of patients. You want to really be careful with the addressing of the problem. This is not something that is going to go away on its own. Just simply eliminating the food is not usually enough. You want to do a little bit of gut healing and modifying the quality of the food that you are consuming. So if you are typically eating low quality meat, if you are, again, not eating the best eggs, just laying off of them for a couple weeks and then going back to eating that quality of product, you're going to keep the cycle going and your body's never going to heal. So we want to make sure that we're improving the quality of the foods that we're eating. And of course, avoiding aspirin, NSAIDs. Citrus juice can be inflammatory. I had another patient in this morning. We had a great talk about the benefits of juicing. And a lot of people are getting on like the juice train right now. They've got some free time. They're shopping online. They're buying themselves a juicer. Be very careful, please, with the type of juice you're consuming and the amount of juice you're consuming. Do not start drinking like 8 ounces of juice every morning and think that this is like the new health kick. Do not do it. There's too much sugar. It can be inflammatory to your system. It can be counterproductive. You can end up with a quarantine 15. So watch that. Juicing a couple ounces is plenty. By couple, I literally mean like 2 to 3. Sticking with greens, maybe putting in a little bit of apple, some ginger would be awesome. And then make sure that you're consuming your juice immediately, because as soon as you juice it and you like put it in the fridge, it starts to decay, it starts to lose its nutrition. So I recommend that my clients, if you're juicing, juice only what you're going to drink right then. And then you got to juice the next day. So kind of keep that going. Vitamin D and K are particularly likely to be low in those individuals that have high food sensitivities. So again, I'm a big fan of supplementing with vitamin D. Most of us, and you can see I still have some pink from yesterday, most of us are not getting enough sun. We're wearing sunscreen. We're wearing a lot of clothing. Ideally you would be outside in very minimal clothing without sunscreen to absorb that vitamin D. And the majority of us are not doing that. So we do need to supplement with it. The other thing that we see hand in hand with a lot of food sensitivities is an H. pylori infection. So that's going to be a bacterial infection that needs to be professionally eradicated. That's one that may actually need to have antibiotic usage. Again, should be done under the supervision of a physician. There are a lot of at-home tests right now. There are a lot of labs that are going direct to consumer, which if you choose to go that route, my concern is the quality of the lab and how the information is being analyzed and the results, what you're doing with those results. So again, that's why my recommendation would be always have a physician that is overseeing your care so that you are, in the long run, spending less time, spending less money, and getting a more accurate analysis, diagnosis, and treatment plan and what needs to be delivered. So a couple supportive nutrients that are good for food sensitivities are going to be a high quality probiotic. We'll probably do a video only on probiotics because I've had some great private questions lately about this. For us, I recommend one that it is at least 25 billion bacteria from several different strains. And by several different, it should be like 8 to 12 strains. It should be ideally refrigerated or in a blister pop pack. So that's all we'll say about probiotics right now. We'll keep the suspense building. Vitamin D3, you want to be doing 1,000 IUs per 30 pounds of body weight, unless you have sarcoidosis or lymphoma. And in that case, you absolutely need to discuss with your physician prior to adding in any additional vitamin D, because it can actually speed up those disease processes. So you want to be careful with that. What else is really good? SAC-B is fantastic. It's found in your probiotics. It is actually a beneficial yeast. It's not a bacteria. It's kind of a misnomer, but it's really good during and after antibiotic therapy. So if you were on antibiotics this past winter or spring and you have not been on SAC-B, we call ours post-antibiotic. It's post-ABX is our post-antibiotic probiotic. So that's what you want to be taking. Or if you had traveled, I won't say have traveled recently, and you end up with like traveler's diarrhea, Sac B is another really good one in those situations. Glutamine is fantastic. If you're doing a whey protein, it's going to have glutamine in it. That's going to be very healing for the gut. Of course, we've talked a million times. I love colostrum for gut healing. That's another great one. Marshmallow is very calming. It's very cooling. It's soothing to the intestines. Apple cider vinegar. I get a lot of questions on this. As a physician, I have to suggest that you put 1 teaspoon in 8 ounces of water before meals, and it will help aid digestion. For me, for those of you that don't know, in my previous life, I was going to be in a bodybuilding competition, and it was figure. It was not like those big, like manly women. That wasn't me. Roids are not in my care plan. But I used to keep a bottle of apple cider vinegar next to the bed, and I would do a swig of that in the morning and a swig of it in the evening, straight. No joke. And it's good. The reason you do it, it helps to burn fat. It helps to alkaline your body. So again, as a physician, I have to recommend you put it in water, but yes, I do it straight. Digestive enzymes, as we age, our enzyme levels decrease. So taking digestive enzymes on a regular basis are going to help you break up your food on a macro level, help you absorb more nutrition from your food. Very easy, great to do. I take them with any protein meal that I have. And of course, turmeric. Turmeric is an anti-inflammatory. It's something that I think everybody should be on. It's anti-aging, it's anti-tumor, it's anti-cancer. Very good product. And super easy. So think of those things if you have thought or could possibly have a food sensitivity. So the second half of the video, real quick, I want to talk about intestinal health. So when I'm working with a client, we work with the 5 R's. So remove, replace, reinoculate. I lost my water. Regenerate. So let's start with remove. You want to remove allergens. So we just talked about having food sensitivity. So it depends on the products that you're eating. There can also be issues that you have been exposed to. It could be a virus. It could be a bacteria. You could have a lack of bacteria because of being on those antibiotics. So you want to be really careful with what you are treating, because there's a very different protocol if you are infected with chronic yeast, if you have a bacterial overgrowth, that you can actually have too much good bacteria, you can have too much bad bacteria, or you can have too little good bacteria. And depending on, again, which of those categories you fall into, your treatment program should be very, very different. And the only way that you are going to know for sure, you're not going to necessarily know based on symptomatology, you're going to know based on testing. So that is another situation where doing some very specific testing will help you be able to diagnose what you're addressing. So do you need more good bacteria? Do you need to be on antibiotics because your balance is so off? Do you need to be on higher dose probiotics? And again, that answer is really only going to come about with appropriate testing. High intestinal pH is also important to know. That's often associated with Clostridia, which is another infection. The second R is going to be replace. So you want to replace anything that's missing. And again, that could be your bacterial balance. That could be your digestive enzymes. That could be, and I'm trying to find some other notes for you. It could be acid support. So it could be the apple cider vinegar. It could be bitters. So those bourbon drinkers, whiskey drinkers out there that have bitters on the bar, bitters actually serve a very good purpose in our digestion. So that can be improved. Zinc is great. Zinc is anabolic, so it's healing. It is great for gut health. Vitamin C. Everybody that is watching this video, that has watched any of my videos, should currently be taking vitamin C. You want to build up your vitamin C to bowel tolerance. So that's pretty much 1,000 milligrams per hour until your bowels tell you that you've had enough. And at that point, you want to do 1,000 milligrams 3 times a day. So those are and I said I wouldn't say the C word in this group. Those are the COVID recommendations. So 1,000 milligrams 3 times a day. What else? Astaxanthin is a product I have not used personally. I have done a handful of research on it because I actually have a patient that said that since he started taking it, he's an older gentleman, he's in his 80s. Since he started taking it, he no longer has to get up at night to use the restroom. And so I want to do a little bit of research and see what the mechanism of action of this was. If it's an anti-inflammatory, if it was helping to decrease prostate size, I don't know. But it was helping him not pee at night. So put that one in your hat for when you need it. Fiber is going to be great. Often that needs to be replaced. A lot of us are not consuming enough fiber or enough fiber routinely. And then, of course, bile acids. So if your digestion is more than just the intestines and the stomach. So we can also have a decrease in bile as we age. So if gallbladder's not working as well as it could be, if you've had a gallbladder attack, if you don't have a gallbladder, then taking bile acids may be a nice alternative for you. Again, re-inoculating is huge. So that could be taking the right number of probiotics, the right type of probiotics. And again, I recommend, let's see if I can find my list here real quick, that your probiotics either be refrigerated or in a blister pop pack, because probiotics are live bacteria. So if you are consuming probiotics that you just like bought off the shelf somewhere, then chances are that they are not alive. That does not make them worthless. However, it will make them less effective than if you find a live probiotic. What else? Prebiotics. I get this question a lot. So prebiotics are actually what feeds probiotics. And that's going to be like your garlic, your leeks, things that are high in sulfur. What else? They're found in things that are higher in fiber and contain inulin. So yes, it is very good. I typically recommend that if you're going to be taking probiotics, you take them with fiber-containing foods. Also, repair. Repair was one R that was sort of combined with replace, because zinc is great for repairing the gut. Colostrum is great for repairing the gut. Glutamine, like we talked before. And of course, rebalancing. So that is going to be all these other lifestyle modifications that we talk about. Managing your stress, making sure that you're eating clean, getting some exercise, keeping a gratitude journal. All of those things are actually going to help improve your gut health, because they're going to decrease stress and they're going to decrease your overall inflammation. A couple other supplements that are beneficial. Green tea, of course, is great. Coconut oil. I cook with coconut oil quite a bit. And whenever I am cooking, I always give, I'll scoop out the coconut oil, I'll put it in the pan to cook, and then I give Parker the spoon to lick the coconut oil off of, because coconut oil is MCTs. It's great for their brain. It can be a little loosening on the bowels. So if you are going to be doing MCT oil straight, or if you're going to be doing coconut oil straight, you want to start out with a little bit and then build up. Most people are constipated, so loosening of the bowels is not necessarily that awful, but just a heads up. The last thing I want to talk about real quick was reflux. So how many people do you know that are diagnosed with acid reflux? How many people do you know that are currently taking a PPI, a protein pump inhibitor? Let me let you in on a little secret and tell you that the majority of individuals that are diagnosed with acid reflux do not truly have acid reflux. The way that your esophagus works is that you should eat something, and then you have a considerable or an appropriate acidic response. So the body uses that acid to break up whatever you eat. And it's almost like a volcano where that acid just comes rushing up. And the esophagus has what's called sphincters, and they close. And I can't even say that word without thinking of Wayne's World. So they slam shut, child of the 70s, 80s. They slam shut, and then that acid does not pass that sphincter. So up here is the esophagus. Now, if you're aging, if you're on certain medications that decrease your acid production, if you're on these PPIs, you're not going to be making enough acid. So instead of the acid whoosh coming up like a volcano, the acid kind of like trickles up or splashes just a smidge, and that smidge is not enough to close the sphincter. So the acid gets up above where it should, produces that acid reflux feeling, and then you go run into your doctor for a medication and you perpetuate the problem. So in reality, I'm going to give you a handful of things that should be done. It is very hard to get off of a PPI. And let me remind you, I'm not suggesting that you do. It is my recommendation that you speak with your physician about getting off of the PPI. No one should be taking you off of a medication except the doctor that prescribed it. Also, please make sure that you're being honest with everyone about the medication that you're currently taking, supplements that you're currently taking or thinking about taking, because all of that stuff can interact. So a handful of ideas to protect against reflux. You want to make sure that you're chewing your food into small bites and eating one at a time. Now, that can be a problem for some of us. We are trying to do 10 things at once. We're eating very quickly. We're eating way too quickly. We're eating processed foods that aren't good for us in the first place. We're eating while we're driving. We're eating while we're having meetings. You're probably eating while you're watching me. So if you can cut down on that, take a deep breath, take a step back, cut your food into small bites and eat one bite at a time. Chew each bite of food 30 to 100 times. Thank you, Auntie Pearl. This is what my grandmother's sister used to always say. Your stomach doesn't have teeth. So yes, you want to chew each bite 30 times. Think about that. Digestion actually starts in your mouth. Your mouth is telling your stomach what to expect, and it can't tell if you don't chew things up first. Eat slowly, waiting a minute after swallowing one bite before you eat the next. Think about that the next time that you're having a meal. Avoid all iced drinks. Make sure that they're at room temperature, because iced drinks are actually going to reduce blood flow to the GI tract and decrease absorption. Now, the reason that the majority of us need to have drinks, especially water, when we are eating is that we are eating foods that are not nutritious. If your food is nutritious, it is already full of water. It is going to be plenty of water. You don't need to be drinking water with every single bite. So keep that in mind. Ideally, I want you drinking your water outside of mealtime. I had that conversation with a patient today. Warm drinks are going to help to improve digestion. What else? Eating smaller meals, eating in a relaxed setting, of course. We hit on some of these already. Avoiding salt. Tomatoes, onions, chocolate, peppermint, almonds, and alcohol all worsen reflux. So do not continue to perpetuate your problem and then try to medicate yourself out of it, okay? Let's change some of these habits and let's clean up our eating before we're having to rely on some of these medications. A B12 deficiency will actually result in excess acid production, and quite a few of us are B12 deficient. With this COVID going on, I have actually increased my B12 intake. I take the lozenges and then I also take capsules. So I'm taking a considerable amount of B12 every single day. Hence why I'm just so lively at, I don't even know what time it is, 9 o'clock at night after being at the office since 7:30 this morning. A couple other hints and tips, same thing. Vitamin D supports stomach motility, so we want to do that. What else can I tell you about? Here's a great one, my favorite topic. Daily bowel movements help to prevent bloating and bloating that can trigger reflux. A high fiber diet, daily fiber supplements can help to decrease all of the space that's being used up in there, that bloating feeling this way, and that bloating up and aggravating acid production. So a couple quick and easy ideas. Losing weight will improve reflux. Smoking actually injures the esophagus as well as the stomach lining, is going to increase reflux. So if you're still smoking, please stop. And again, these acid suppressing drugs like Prilosec have a handful of adverse side effects themselves. So Prevacid increases the risk of sudden death. That is per their CEO. So that is not some study that alternative medicine practitioners did. The CEO of Prevacid admitted that taking Prevacid increases the risk of sudden death. What else? Risk of death is 51% higher the year after individuals are discharged from the hospital. So if you have other comorbidities and you're also taking Prevacid, you want to be exceedingly careful. And that increase actually goes up to 159% if you're on a high dose of Prevacid. Acid kills bacteria and viruses, which of course is what we want. So if you're currently taking a PPI and you're purposely decreasing your acid production, you're decreasing your ability to kill viruses and bacteria. Hello, what are we all quarantined for? So let's get healthy. Ashley, you should be sharing all of my videos with your father. Your father should be my number one fan. For those of you that don't know, I don't know, Ashley, what do you consider? My cousin once removed. Ashley's father and I are cousins. We could be siblings. I'm the cute one. What else can we talk about? B12. Another reason that B12 deficiency is an issue. B12 is needed to make melatonin and therefore sleep. Of course, we all need that. This is great. For those of you that don't know, every Monday at lunchtime, I do a live video with OsteoStrong, which is a really awesome brick and mortar location that does work to increase bone health. So if you fall into that category, then please give that a look. But B12, again, is needed to make melatonin. And in 35% of postmenopausal women, hip fractures rise. So we want to really watch our B12 levels, our melatonin levels. We want to make sure that we're sleeping. And one more reason that our PPIs are damaging us, that they are exceedingly addicting. Okay? In healthy volunteers that were given acid suppressants for 8 weeks, they had a mild to moderate rebound. So it's called acid rebound for more than 4 weeks after. And the withdrawal can be permanent in some people. So if you have ideas of going off of your PPI, if you have questions, there's no question about this. You must discuss it with your physician. If you would like assistance, you can contact me, but your physician has to be involved. And this is something that you need to be highly committed to because it's not an easy fix. It is a necessary fix. It is not an easy fix. So you need to be ready to make some healthy modifications. Acid suppression by prescription drugs substantially reduces the absorption of other prescription medications. So typically, and I will tell you this from a medical standpoint, I often do not see patients that are only on one medication. You probably have multiple chronic comorbidities, so you're on at least one medication. You're probably on a second medication to work on the side effects of medication number one, and so on and so forth. And that tree keeps growing for all of the different medications that you're on. So if you have high blood pressure and diabetes, or if you have high blood pressure and high cholesterol, you're probably on 2 medications, one for each of those problems, and then you're on another 2 medications to help with the side effects of these medications, and so on and so forth. So I'd be really careful about what you're taking, the side effects. And side effects can change over the years. So don't think just because something worked for you for a little while and you start developing muscle spasms, or you start developing sleep difficulties, or you start developing difficulty with breathing, do not think that that is an outside problem. It is probably linked as a side effect to your medication. So just keep that in mind. If there are any questions, let's take a look real quick and see. Teeth. What's your question with teeth? I don't see any other questions on here. So if anything comes up, if anything that I discussed is helpful, if you have something to add, please feel free. Tomorrow, make sure you tune in, because my good friend Annette and I are making cookie dough banana ice cream live. So make sure you tune in for that. It's going to be absolutely awesome. Annette, if you don't know, is the chef, the private chef and health coach that was nice enough to come on our last women's retreat with us, and she cooked for us all weekend. It was incredible. We ate vegan all weekend, and honestly, I don't think people knew. It was gorgeous. It was delicious. It was amazing. So she is going to be cooking with us tomorrow. So if you want to participate, check out the link that is in the group. You're going to need frozen bananas. So if you got bananas at home, stick them in the freezer, peel them, stick them in the freezer tonight, and you can make your ice cream with us tomorrow. And then the cookie dough is actually made with chickpeas. Who knew? So I'm going to try to make the whole recipe. We'll see. There's some people that have already said they're just going to try to make the ice cream. So let's see who can do what we come up with. And then I expect everybody to be sharing their ice cream after. I want to see the after. I want to see all the photos. And they better be Instagram worthy. So let's do that. That's tomorrow. Let me check my schedule. And then Wednesday, I think, my good friend Suzanne Norman is going to be on. We are going to be doing a meditation together. She does a whole bunch of mindfulness work. So we're going to be chatting. Thursday, I think you may be stuck with me. And then we'll see. Friday, I think, is going to be my good friend Robin, who is a personal trainer. She's a health coach. We've been friends forever, for like 15 years. And Robin was actually on our women's retreat with us. So we are going to be talking her wellness and stress management tips. So Cheryl, you're tuning in too late. You missed. So for those of you still on, Cheryl is my cousin, or Jan's cousin. And she is Auntie Pearl's daughter, who, when we were discussing the benefits of chewing your food, Auntie Pearl is who I was referencing. That is her mother. And Auntie Pearl would always say, your stomach has no teeth and you need to chew your food 40 times. So legit, when I'm referencing someone, it's real. I'm not creative enough to come up with this off the cuff. So I hope that you learned a little bit about food sensitivities tonight, about gut health, about acid reflux. Okay. If there's a topic that you want to know about that we haven't covered as it pertains to stress and wellness and inflammation, feel free to post it here. Send me a private message. I'm happy to discuss it privately or bring up the topic anonymously. And remember to share the group. That is my one ask with all my dedicated hours of information here. You never know who's not okay. And I'll tell you right now, none of us are okay. This whole situation is not okay. So please share the group. Share it in the moms groups that you're in. Share it in your networking groups. Share it on your page. And you literally have to spell it out to people so they understand what we're doing. So invite them. Let them know something that you learned. Let them know how entertaining and randomly full of information I am. Whatever you're getting out of this. Just the human connection one night, 1 hour a night. Whatever it may be. But I would ask that you share the group, tell people to join us over here. It's free, it's fun. I had somebody suggest that we do a giveaway. So when we hit 500, we're going to do a $100 giveaway to Salutogenic Life. So share it. Love you all. I'm going to go make sure Parker's sleeping and not watching Spider-Man. Those of you that know me intimately, that has been his uniform for the past month. Spider-Man AM pajamas, Spider-Man PM pajamas. So keep your fingers crossed for me. I love you all. Have a wonderful night. Go freeze your bananas. And I'll see you in the morning. Ciao. Sweet dreams.